So this is a cardiac cycle. It's simply a diagram illustrating what we have been talking about. This is contractions and relaxations of the ventricles and atria. And it always starts from phase 1 to 7. And in phase 1, we start from atrium, and we call that one simply the contraction of the atrial, represented by the green line there. It's not quite visible well. But the time the atria contract, both of them, we call that one the systole. We reach some point where we have a contraction, but the volume is not increasing, reducing. And we call that one the isovolumetric. Iso means zero or constant. So the volume is zero, but we're still having a contractions of the cardiac muscles. It would be followed by the rapid ejection. So rapid ejection is when the ventricles are pumping blood out, which happen in 2 stages. So initially it will pump very fast. We call that the rapid ejection in a few seconds, followed by a slightly slower ejection, which also takes another seconds before the valves closes. And once the valves will have another relaxation, relaxations occur without the relaxations of the muscles, that the volume still remain the same as much as you're having a relaxation, and call that one isovolumetric relaxation. So we have phase 2, which is isovolumetric contraction, and phase 6, which is phase 5, which is isovolumetric. So finally, we have feeling. This is where the atriums are had, because after the pumping by the ventricles, and same with the ventricles. So the filling of the atria occur in 2 phases. So we have a rapid initial phase, which is followed by a slightly reduced filling phase. And that one, the cycles complete and it will start again. Each and after every heartbeat, the cycles repeat. And through that one, at the end of the minute, using the volume, that is how we are able to get or calculate the cardiac output. At the same time, when you see the ECG tracing, so we have our P waves here caused by the contractions of the atria, represented by letter A. And then we have the QRS complex, which we said the 3 waves combined together represent the contractions of the ventricle. And once the ventricle contracts, it coincides rapid ejection. That one is relaxation is relaxation by the way of the P and T, and it will repeat. This is volume indicate the left ventricular and diastolic. But at the end of that one, it will reduce and it will repeat again. The cycle continues. So the contraction, we call it the systole, and the relaxation, we call it diastole. So this is what you call the cardiac cycle, or the phases or the events in the cardiac cycle. So in summary, we said it start from the atrium, and this is where FE node, it causes contraction. Later, the ventricle will have the ejection by the ventricles, which occurs in 2 phases, a rapid one and a slow one. And once we have the ejection of blood, the valves will close and the atria will be filled with blood again. And we call that one both the rapid and the slow filling processes. So that is a sum of the cardiac cycle.